One evening, Nancy prepared Ron's favorite dinner, seared scallops, golden and steaming on the plate. But that night, something was off. Ron just stared at his food with disgust, his appetite strangely gone. For a man who loved his meals, it was out of character. Nancy brushed it off as nothing, but over the next 2 weeks, Ron's appetite kept slipping away, replaced by something darker. Then came the cough. It started small, a raspy tickle in the back of his throat, but soon it became relentless, deep, hacking fits that left him breathless, shaking and pale. His chest would lock up, his head tilt back, and his entire body tremble as if under attack. 17, 18 coughing fits a day. It was terrifying to watch. As days turned to weeks, Ron grew weaker, his breathing labored, his energy fading. When his sister came to visit, he could barely stay awake on the couch, and then, one night, his body gave out. A violent fit struck, his breathing ceased. Nancy dialed 911 as Ron gasped for air, his blood pressure plummeting, oxygen levels crashing. By the time paramedics arrived, his life hung by a thread.
Ron's symptoms, cough, fatigue, breathlessness, fit the picture of severe pneumonia. Pneumonia is an infection of the lungs, where the tiny air sacs, called alveoli, fill with fluid and pus. This prevents oxygen from reaching the bloodstream, causing dangerous drops in oxygen saturation and blood pressure. When paramedics found Ron's levels unbelievably low, his organs were starved of oxygen, a condition called hypoxemia. If not corrected, it can rapidly progress to respiratory failure and multi-organ collapse. At the hospital, chest auscultation revealed crackles, and imaging confirmed pneumonia. IV antibiotics were started to combat the presumed bacterial infection, but something about this pneumonia didn't fit. The infection wasn't clearing. The cough persisted, and something strange was lurking inside Ron's left lung.
Ron's pulmonologist, Dr. Scott Slater, ordered a chest X-ray. What he saw made his stomach drop. Part of Ron's left lung had collapsed. Something was blocking his airway. A bronchoscopy was performed, a thin camera inserted deep into Ron's lung. As the lens traveled through the trachea and down into the bronchial tubes, Dr. Slater froze. There it was, a mass, smooth and round, clogging the airway like a cork. He took a biopsy immediately, then came the wait. For days, Ron's family lived in agony, fearing the worst. Lung cancer, the word no one wanted to say out loud. When the pathology report finally arrived, the result was normal, no cancer cells, just inflamed tissue. Confusing, maybe a false negative? Dr. Slater wasn't convinced. He went in again for a second bronchoscopy. Same result, normal tissue, still no answers. Ron's body was still failing, and his doctors were running out of theories, desperate for answers.
This is what normal lungs look like, but a collapsed lung segment with an obstructing mass often points toward malignancy, like bronchogenic carcinoma, or an aspirated foreign body that's become walled off by inflammation. When tissue samples come back normal, but the visual findings show obstruction, doctors suspect granulomatous reactions, immune-driven growths caused by infections, inflammation, or trapped material. These masses form when the immune system detects something it cannot eliminate. Macrophages and lymphocytes swarm the site, creating a tight capsule of inflamed cells. Over time, this can mimic a tumor on imaging and physically block airflow, causing atelectasis, the collapse seen on Ron's scan. Yet, despite biopsies, Ron's tests showed no bacteria, no fungus, no cancer. Something foreign had triggered the inflammation. But what?
Dr. Slater called in a thoracic surgeon for a third bronchoscopy. This time, Ron was placed under general anesthesia. Hours passed in tense silence. Then the surgeon called. "Do you have any dirt?" he asked. Confused, Dr. Slater replied, "Excuse me? You'll need some dirt," the surgeon said. For what I pulled out of your patient's lung." Moments later, the truth emerged. The surgeon stood at the foot of Ron's bed, mask hanging loose, disbelief still in his eyes. "It was a pea," he said. A pea, a small green vegetable, had been living and growing inside Ron's lung.
What Ron experienced is an extraordinary case of aspiration, when food, liquid, or another foreign body accidentally enters the trachea instead of the esophagus. Normally, a small flap of cartilage called the epiglottis closes over the airway during swallowing, diverting food safely to the stomach. But if the timing is off, due to talking, laughing, or a simple reflex error, a small object can slip past and enter the bronchial tree. Most people immediately cough it out, but if it lodges deep enough, the cough reflex may fail. Once trapped, the body reacts. The immune system surrounds the object with inflammatory cells, forming a mass called a granuloma. This explains why Ron's mass looked abnormal, yet biopsied as normal tissue. It was his own body's defense reaction. The pea's organic nature added an extraordinary twist. In the warm, moist environment of Ron's lung, it germinated, sprouting tiny roots that embedded into the airway tissue. The partial blockage prevented air from reaching the lower lung, causing collapse, chronic infection, and severe pneumonia-like symptoms.
For weeks, Ron's life had been unraveling because of a single swallowed pea. A simple accident, likely during a meal months earlier, had nearly killed him. When the surgeons removed the pea and surrounding tissue, Ron's symptoms vanished almost overnight. The cough stopped, his energy returned, his lungs slowly re-expanded. Nancy and the family could finally breathe again. Relief replaced fear. Disbelief replaced despair. A living plant had been growing inside him, and it nearly took his life.
Aspiration of food material is more common than most realize, especially in older adults, where swallowing reflexes may weaken. Foreign bodies in the lungs can remain undetected for months, causing recurrent infections, persistent cough, or even lung collapse. In Ron's case, diagnostic challenges arose because soft organic material like a pea doesn't always appear clearly on X-ray or CT, often blending with surrounding tissue. Only direct visualization through bronchoscopy revealed the truth. Once removed, lung function typically returns to normal, provided no permanent scarring or fibrosis has occurred. Ron's story is a remarkable reminder of how delicate and resilient the human body can be.
From what seemed like a terminal illness came a miracle of nature and medicine, a pea that sprouted life inside a dying lung. Ron Sedin walked out of the hospital alive, his lungs clear, his appetite finally back, and though he'll never look at vegetables the same way again, his story will forever remain one of the strangest medical mysteries ever recorded.